Hi, I am Dr. Nalla Perumal from Chennai. I am a consultant diabetologist practicing at Motherhood TTK Road, Alvarpet. So, in this presentation, I am going to talk about gestational diabetes, which has become very prevalent nowadays because of various factors. Before going into how to manage pregnancy diabetes or gestational diabetes, I need to tell you how we diagnose gestational diabetes and who are the people at risk to develop gestational diabetes. So, pregnancy is a very happy occasion for any family, and when the pregnancy progresses smoothly, when somebody gets diagnosed with gestational diabetes, there is a reason to get shocked. Many people get depressed, but you need not worry because this can be managed nicely provided you get focused on what is required during pregnancy. So, what are the risk factors for gestational diabetes? Suppose if you have a family history of diabetes, say either of your parents or both your parents have got diabetes, you have a strong family history. Then if you have polycystic ovaries, then there could be an increased risk. If you are overweight for your height or obese for your height, then there is an increased risk. If you have a history of previous history of big baby, birth of a big baby, suppose if your previous baby was weighing more than 3.5 kilogram by Indian standards, it is called big baby or macrosomic baby. If there is such a history, then there is an increased risk. So, when somebody has got risk factors, we usually do the screening tests. But currently, since we get to see a lot of young women with even pre-existing diabetes, the guidelines have changed. Previously, gestational diabetes screening happened only around 24 to 28 weeks of pregnancy. Now, during the first antenatal visit itself, your gynecologist will be looking for any abnormality in the sugars. So, if it is very early pregnancy, they will do a fasting plasma glucose and a HbA1c to rule out pre-existing glucose abnormality. And if you have crossed say around 11-10 weeks, then every trimester we have to do a 75 grams GTT, that is glucose tolerance test. You will be asked to come in the fasting state, and after 8 hours of fasting you will be going to the lab, and you have to be there in the lab for 2 hours. They will be giving 75 grams glucose dissolved in 200 ml of water, and you have to drink that and sit there quietly for about 2 hours. They will draw another sample apart from the fasting sample. They will draw another sample at 1 hour and 2 hours. So, there are certain cutoff criteria. When we apply the IADPST criteria or WHO latest criteria, then the fasting value should be less than 92. The 1 hour value should be less than 180, and the 2 hour value should be less than 153. If any one of the value equaling or crossing these cutoff values, then you will be diagnosed with gestational diabetes. But there is another criteria, that is DIPSI criteria, Diabetes in India Pregnancy Study Group criteria. So, according to their criteria, if the 2 hour value crosses 140 milligram itself, then you can get diagnosed with gestational diabetes. So, whatever the diagnosis is, when the diagnosis happens with the GTT, the doctor is not going to medicate you. So, first we will advise a lifestyle modification. That means you will be asked to meet a dietitian, qualified dietitian, and the dietitian will be looking into what you are eating, and they will be planning a meal plan which is appropriate for the gestational week as well as for your weight and present problem. So, you are supposed to follow the nutritional guideline, the diet plan, and then you will be asked to do some exercise, which is again appropriate for the stage of pregnancy as well as approved by the gynecologist. Because remember, in pregnancy the gynecologist is the primary consultant. Sometimes there could be contraindications to exercise in pregnancy, so we need to always check with them before undertaking any form of exercise. If they allow, then you can casually walk, do even swimming. All that exercise is possible in pregnancy. Then after 2 weeks of lifestyle modification, if the sugars are not getting controlled, so in the meantime we would have advised you to get a glucometer and start monitoring your sugars. So if the self-monitored values are away from the target, then we may have to start treating. So one form of treatment is metformin. It's not everybody. If you have polycystic ovary, if you have pre-existing overweight or obesity, then metformin can be tried. Otherwise, insulin is the best option. Insulin never crosses to the fetus. So when it comes to insulin, there are a lot of stigma associated with using insulin, or myths associated with using insulin. So whatever people think about insulin, majority of the opinions are false. So insulin is a protein. It has got a huge molecular weight and structure. It can never cross the placenta. So insulin given to the mother will not harm the baby, and only the glucose is getting transferred to the baby. So and after delivery, since gestational diabetes itself will resolve as a problem, so you won't require insulin after delivery. So it's a myth that once you start insulin, you will be on insulin. This is not true in gestational diabetes. And insulin will be started for the meal which is showing up with the higher numbers. So the doctors might intensify the treatment depending on the meal times which you have found abnormal values, and then as the baby grows, slowly the placental hormones keep going up, insulin resistance develop, and you will require more and more insulin to keep the sugars under control. So what we need to remember here is, just because you have developed gestational diabetes, the baby's requirement doesn't change from the baby of a non-diabetic mother. So all the babies require the same kind of nutrition. So we need to provide the baby with the appropriate nutrition. At the same time it goes up, the sugar goes up, then we need to treat. So what I'm trying to tell you here is, strict dieting is not an option in pregnancy, because that might affect the growth profile of the baby. So we need to give insulin in such a way that the mother is allowed to eat the appropriate food and then make the baby grow in a healthy way. So we need to achieve the target fetal weight, or the birth weight for the baby should be appropriate, and because that is going to play a role even in the future development of diabetes. A baby born at a very low birth weight and a baby born with a very high birth weight, both of them are at a higher risk to develop diabetes in their adult life. So appropriate weight for the baby around the time of birth is very, very important, even for the future of the baby, to control the future development of diabetes. So weight management is very, very important. And for mothers who are overweight already or obese already, so they need not eat for two, because they have got already enough energy resource in their body. So we will be asked to consume less calories compared to a woman of appropriate weight or underweight. So a nutritionist counseling is very important here. Self-monitoring with the glucometer is very important, and if you are on insulin, you have to take insulin and food on time, and take a snack in between, so that you are not at a risk to develop hypoglycemia. Once delivery happens, the placenta also is going to be delivered. The new placental hormones will vanish and your insulin will be back into action. So within minutes after delivery, your sugars will become normal, and you can have a normal life. But having said that, so development of gestation diabetes is a strong risk factor for future diabetes. A lot of women, almost 50% of them who have developed gestational diabetes, can develop type 2 diabetes in their later life. And diabetes is striking more and more people earlier and at a younger age group. So it is important to assess the risk after delivery. So how do we assess that? We recommend a GTT, again 75 grams GTT, 6 to 10 weeks after delivery. If the GTT at that point of time is absolutely normal, there is no increased risk apart from your previous history. If the GTT is already abnormal, then you have to follow a lifestyle modification, so that you will be trying to prevent diabetes in the near future. So this GTT, which is recommended 6 to 10 weeks after delivery, majority of the women don't do it honestly, because once the baby is born, the mother's life revolves around the baby. So many of them do miss this GTT. They don't come on time to do the GTT. So it is important for your health, future health, that you need to undergo this GTT. And after delivery, your sugars become normal. What is very important is to lose the weight which you have gained during pregnancy. In my experience, many of the women who gain a lot of weight during pregnancy, they don't lose much of it. So they retain part of the weight, and when they plan for the next pregnancy, they are at a disadvantageous position because they are older by that many number of years. When the second pregnancy is being planned, so suppose say 5 years later, the woman is almost 5-6 years older and 6, 7, 8 kilos heavier than the previous pregnancy. So in such instances, the pregnancy diabetes or gestation diabetes develops faster. So it is important to lose the weight, and it is important not to gain much weight during the interval period. We call that as interval weight gain, which is again another factor in development of gestation diabetes faster. So post delivery weight management is very important to prevent future diabetes as well. And as far as the baby is concerned, the baby has no further implications. First 24 hours we need to just assess the baby, and if required the baby will be kept in the NICU, and then will be given to the mother as early as possible for feeding. So feeding is very important. Mother's feeding helps the baby to even prevent future diabetes, and the baby will grow into a normal child, healthy child and adult, and have a good normal life even in the future, provided pregnancy diabetes is managed appropriately, because everything is programmed in the uterus. So good management of pregnancy diabetes is vital in keeping the adult health intact for the baby. Thank you.